Earlier this week, we found out former President Biden has been diagnosed with stage 4 prostate cancer.
Yeah, that's right. Our 9 News health expert, Dr. Kohli, is joining us this morning to talk more about this. Dr. Kohli, good morning.
Good morning.
We know that prostate cancer is pretty common, even in older men. What symptoms did President Biden present?
Very, very common. In fact, the most common cancer after skin cancer. So if you look at 100 American men, 8 to 13 of them will get prostate cancer, and 2 to 3 of them will die from their prostate cancer. So thankfully, it's not one of the cancers that kills people, but in President Biden's case, he was having urinary symptoms that prompted a trip to the doctor. Now, this is a very common way that prostate cancer presents, and they found a little nodule and they biopsied it and turned out he had Gleason 9 prostate cancer. Sometimes men will have no symptoms at all with their prostate cancer. It's just picked up on a PSA, which is a blood test, prostate-specific antigen, that starts to go up because the cancer cells are making this particular marker. But if you have urinary symptoms as a man, it's really important to go to your doctor right away.
So talk about that Gleason score and how that works.
Yeah, it's a really important score, and we use it as a way to figure out how aggressive the cancer is and also as a way to sort of guide our treatment. So you take a little biopsy, a tissue from the cancer, put it under the microscope, and then look to see how tightly the cells are clustered. The lower the score, the better. It's on a scale of 1 to 10. So he got a 9 out of 10, which makes his cancer pretty aggressive.
Right.
It means the cancer cells have already got high potential to spread outside the prostate. We know in his case they already have. And it also tells us that we probably need to use combination therapy, more than one type of therapy to treat the cancer.
You mentioned a blood test is one way that can detect it. Is this a blood test that you have to ask for in addition to the ones you might get for your checkups?
So for kind of an average risk man, and we're seeing prostate cancer go up in men as well, you start to sort of check your PSA every 2 to 3 years, starting at the age of 45 to 50, depending on your risk. If you're high risk because you're African American, you have a family history, you can start as early as 40. Generally, you shouldn't have to ask your doctor for this test. It should be part of the regular panel. But again, if you have urinary symptoms, or in older men, we also get a condition called benign prostatic hypertrophy. The prostate is supposed to be a tiny little thing. It starts to swell up. It's not cancer, but it just gets bigger. That can also raise your PSA, so you can get false positives on that. Now, for President Biden, the tricky thing is he was 82 years old. That's the age where we stop checking PSAs in general, because the guidelines don't recommend it in older men, because usually prostate cancer is slow growing. So it's not clear whether he had a PSA checked or not when he had his physical in 2024 as the president.
I think it's so interesting. I saw something yesterday that said, like, this isn't something that's developed in the last 100 days. This is something that he likely had during his presidency. So how was it missed?
Very much so. So because he's 82, maybe they weren't checking the PSAs, because he had this physical in February of 2024 where his physician said that he's in great health. The other possibility is that the PSA wasn't elevated if it was checked, because you can see, especially the aggressive cancers, that the PSA suddenly kind of pops up between screenings, because remember I said 2 to 3 years, and so that's a long time. You can basically get a development of a prostate cancer in that time. So it's not completely unusual, even if you are getting your regular PSA screenings, to see this. But as a man, if you're not getting the PSA screenings, this should certainly be a wake-up call, because this cancer is so common in men, and we're seeing it increase.
And just real quickly, you said those typically begin at 45 years old?
Begin at 45, yeah.
Okay.
And I know President Biden is considering a lot of different treatment options. Thankfully, his cancer is hormone sensitive, which means they're probably going to start at least with hormone blockers, probably give radiation because he's got, spots in his bones. He's not having bone pain, which is a great sign in terms of prognosis. So even though he has this very advanced cancer, stage 4, I'm optimistic that he can still have a good quality of life and get treatment.
And this development is a good reminder for everyone to get checked out if they're in that group.
Yes.
All right. Dr. Kohli, thank you.